the room and then came back in with a book. He was like so excited about it. It was so weird. And he was like, it's molluscum contagiosum. And so we assume she either got it from like the daycare, or they say in a pool, if you're next to someone. So she had this, on the outside of her arm, outside, kind of like her shoulder area. And the treatment was this little medicine that came in this little, like, kind of looked like a hot sauce package. And you opened it up, and he was like, just get a little bit on a toothpick and just dab it right on there. Don't get it around on any other skin. He's like, you don't touch it, and just put it on there. And the medicine, I read about it, and it was also used to treat basal cell carcinoma. And so anyways, it went away. But that's somebody, I know somebody who's had this. So don't freak out. I promise you, she was little. It must have been from the pool or from school or something. So here's herpes. I like herpes. Herpes looks like one of those bouncy balls that when it lights up, right? So this is herpes. This is the first of the viruses. You do not want herpes, okay? We have, well, there's lots of types of herpes. Okay, you can get herpes in the eye. You can get, you can get herpes on your vagus nerve, and then that causes what we know as Bell's palsy, where your face droops. So there's different types of herpes. The two that we'll talk about today is herpes simplex 1 and herpes simplex 2. Okay, herpes simplex 1 causes what we call oral or labial herpes, and that's when you have fever blisters, or some people call them cold sores. So I have this. I get cold sores. I'm going to knock on wood because it has been a very long time since I've had one, but I am a sufferer of cold sores. My daughter Bella also has cold sores. She may have easily got it from me, because you can get it just from sharing drinks, sharing chapstick, anything like that. These are very, very easy to pass along, okay? Once you have them, you will always have them. I'm not sure in the slides that come up, I think it will, so we'll talk a little bit more about this. Genital herpes is the herpes that you think of down on your genitals. These are a lot of blisters that are on your genitals. This one usually just causes one sore on your mouth, and it's usually contained to your lip. It might venture down a little bit on the skin, like under or above your lip, but it's usually confined to the lip. Genital herpes gets all on the skin, and it spreads and it gets everywhere. Okay, so painful blisters, penis labia or vaginal walls. Okay, this is the genital. The oral one, it hurts. You can always like feel it coming on, like tingles, and then once you have it, it really is painful. When the genital herpes, the blisters break, they leave kind of an open sore. That discharge has the virus in it. A few days, the sores will eventually dry up and disappear. Outbreaks, do recur over time. They do say that the frequency decreases, and this is exactly what I'm experiencing with my cold sores, right? I really don't get them anymore. Okay. There are a lot of different types of treatment for genital herpes or for oral herpes. For cold sores, you can get that. Oh my gosh, now I'm missing the name of it, but there's lots of little things that you can just buy at the store, like a little cream or whatever, an ointment that you can put on it. You can also take like Valtrex, you can take Famvir. There's several different oral treatments. So here is genital herpes. I'm sure these hurt. The female, it's a little bit harder to see, right? But they're in there, okay? You know, we really know that herpes is passed when you are not showing signs, because if this is super painful, I seriously doubt this person is engaging in sex at this time. Okay. So we really, really, really know now that herpes is passed when the person is asymptomatic. All right, here's HPV. This one reminds me of a ball that you would throw at the wall, and it has those suction cups on it, right? And it sticks to the wall. This is what HPV looks like. Okay. The human papilloma viruses are, this is a big group of viruses. I want to say they have over 170 identified. The vast majority of HPVs might cause a little bit of like a cold symptoms or something like that, but your body fights them off, okay? It doesn't do anything to you. There are some HPVs that cause what we call just your common wart, the warts on your fingers. Those are from, or warts on your face. Those are from HPV, okay? But a non-serious HPV, you can easily go get wart cream or have them removed or something like that, okay? HPV is the cause of genital warts. All right. And they've now identified that HPV types 6 and 11 are the ones that cause genital warts. These are non-cancerous. Okay. They're highly infectious. All right. They don't usually cause any pain, but you can see them and they can be, you know, you just don't want them, right? So you can go to the doctor and they can give you medicine, or they can burn them off, or they can give you an ointment or something like that, and you can treat those genital warts. This is what that would look like, right? This is a very common, what a wart would look like, right? It's usually kind of whitish and they're very bumpy. I'm sorry to do this to you. I'm going to ruin another food. Cauliflower. We usually say that cauliflower or a wart has a cauliflower look to it. There's lots of little bumps and ridges. Okay. You guys are never going to have cappuccinos and, oops, cauliflower again. HPV 16 and 18 are our #1 most dangerous HPVs. They're the ones that can lead to cancer. Okay, so they've identified 16 and 18, and in fact, it might even be more than that now, because I want to say it's Gardasil 9. And Gardasil 9 protects against 9 of the most dangerous HPVs that are identified. Okay, so right now we've only gone over 4, right? 6 and 11, and then 16 and 18. So Gardasil 9 protects against all those 4, and there's another 5 in there. Okay, so these are the 2 that cause most what we know of cervical cancer, but nowadays we know, let's see if, oh, it doesn't have it, but okay, we know it causes cervical, penile, anal, mouth, throat, esophageal cancers. So we know that these are the #1 causes for those cancers. So the fact that they have a vaccine now for those, for both boys and girls, to me, that just blows my mind. I mean, this is a vaccine for cancer, right? So I highly, highly recommend for you to take your kids, or you yourself, if you haven't, go get the HPV vaccine. This is cervical cancer. Okay, this is a very, very sick cervix. Like I said, warts can be removed by freezing them or burning them off or something like that. Here's that Gardasil, and you know, ages 11 or 12 is when they've recommended it. It's boys and girls. Over the years, it's kind of changed about whether you need 2 or 3. It depends on how old you are when you get it. The doctor will obviously know. And Gardasil 9 is now the second kind of version of this. A long time ago, it was Gardasil, and then there was another one called Cervarix. Gardasil really only protected against the genital warts 6 and 11. Cervarix was the one that was protecting against 16 and 18, the cancers. Gardasil is from the company Merck. They're very big, they're very powerful, and Cervarix never really made it very far, even though it was the one that was protecting against cancer. But now you have a new and improved Gardasil, which includes the warts, the cancers, and whatever others that are in there. So I highly recommend getting this shot. Both my girls have gotten it, no ill effects, no side effects whatsoever. And it gives me peace of mind that they're not going to be hopefully susceptible to all of those cancers. Hepatitis. Okay, another food. I'm sorry. This reminds me of the like Puffs Cheeto mix. You got the Cheeto Puffs and then the little balls and stuff. This is our hepatitis. Hepatitis viruses attack the liver. You can tell when somebody has a liver problem because they look yellow, right? Or they have jaundice. Their skin is yellowy, the eyes are yellowy, and that's caused by something happening with the liver. It does not mean that they have hepatitis. They can, but they might have something else. They might have cirrhosis of the liver. They might have cancer of the liver, okay? But that yellowing of the skin and face is a bad sign, okay? So, oops. Well, there's the yellowing of the eyes, right? If you ever see that, that's very, very dangerous. You can even kind of see in this picture a little bit of the yellowing of her skin, okay? Let's see, cirrhosis, yeah, cancer, okay. All right, chronic hepatitis B can be treated but not cured, okay? There are hepatitis B vaccines. Babies will get hepatitis B vaccines when they're in the hospital. I don't remember if they need a booster or anything. I don't remember anything along those lines for hepatitis B. I do know if you go work in a hospital setting, you will have to get a hepatitis B vaccine because hepatitis B is from blood. And if you have an accidental needle stick, you have about a 30% chance of contracting hepatitis B if that needle contained blood from somebody that has hepatitis B. So that's a pretty high risk factor there. So hospitals will make you get vaccinated for it, okay? Because of the vaccine, you really don't see hepatitis B too much anymore. Hepatitis A is transmitted sexually because of fecal matter. So we really want to be careful with things like that, okay? You know, anal sex, you just want to be careful. You know, coprophilia, anybody who likes fecal matter, you want to be careful because you can get hepatitis A. Okay, again, there are vaccines for hepatitis A, so that's good. Oh, it doesn't have it on there. Hepatitis C is something that is also obviously affects your liver. It is believed you can get it sexually. Tattoos is another way you can get hepatitis C. This is also through blood. So you want to be careful with that one. They do have a medication now for hepatitis C. They do I think in the commercials, you can hear that they claim to cure hepatitis C. You want to be careful with that definition of cure, and how they are defining that. Okay, so what is technically a cure? How long does it go away? Does it go away completely or not? So, but hepatitis C, you definitely have some more medications coming out on the scene for that. Here's HIV and AIDS. Okay, so HIV causes AIDS. HIV is the human immunodeficiency virus. Okay, it hit the scene in 1981. Okay, it's what we call a retrovirus. Its RNA is transcribed into DNA once it gets into the cell. It is similar to what affects chimpanzees. Here is some statistics about HIV. This is for the United States. This is globally. Okay, you know, here in the United States, we're doing better. We certainly are doing better when you compare us to the world, but we still have quite a few new infections. Okay, so we want to be careful with that. Yes, we did start seeing it originally in gay men, and that's just because of the nature of their sex. You know, anal sex between gay men, they're probably not wearing a condom, and a lot of times there's blood. And when you get that, you have a very high chance of getting HIV if the person has it. Okay. Please know it is absolutely spread through heterosexual sex as well. In fact, here in El Paso, the #1 person to get HIV is a young Hispanic female. That is the #1 person that they see in El Paso with HIV. You can get it from needles, and well, it says here blood transfusions, but really the blood now is tested, and that you don't see this anymore. And of course, it can go from the mom to the child. And it doesn't have it here, but it's also spread in breast milk. Oops. So, you know, most male-to-male contact, heterosexual, drug use, maybe a little bit of all of it, right? Is the #1 way people are getting it right now. African American make up a huge chunk, whites, Hispanic, and other. The #1 way to receive or to increase your chances of getting HIV is to be on the receiving end of anal sex. Okay. If you are the receiver, you have a really high chance of getting it. Insertive, a little bit less. Coitus receptive. So girls, heterosexual girls having vaginal sex, you're more likely to get it than the male. Okay. And oral sex is so low. I mean, your saliva, the HIV virus is actually very fragile. It does not survive on surfaces. It really, as soon as oxygen hits it, it really struggles to survive. So your saliva, your stomach acids will kill the HIV virus. Now, why it's low and not just non-existent is if by chance you have a huge wound in your mouth and blood is present and you then engage in oral sex, then yes, you could get it. But you would have to have a pretty big bloody sore in your mouth. This is just talking a little bit more specifically about what it does. It affects those T cells, but more specific, the CD4 T cells. You know, it can stay in somebody for 7 to 10 years, that you may not even know you are HIV positive. In fact, nowadays, unless you go get tested, which you can get tested free of charge at the Lafayette Clinic, most people today find out, that they are HIV positive is when they go to the hospital because they're so sick. They either have pneumonia or like a kidney infection, a bladder infection, and they've gotten so sick that they go to the hospital and the doctor comes in to tell them you have pneumonia. Oh, and by the way, did you know that you are HIV positive and you now have full-blown AIDS? So that is a very hard way to find out, okay? Because people do not go get tested. If you get tested, they have so many good medications now that you can live for years. In fact, we now have data that shows that these medications make the HIV undetectable in your blood, so that it is so low, you're not even carrying really the virus anymore, okay? So you wouldn't know that though, unless you got tested. So you don't want to go to the hospital and find out you are already full-blown AIDS. I am not going to even pretend to know all of this stuff, but this is how HIV affects your cells. When your CD4 T cells drop below 200, then that's when you have full-blown AIDS. Okay, so once they just drop, and then you're at 200, that's when you have AIDS. We have a lot of antiretroviral drugs nowadays that are doing really good. Here's the pictures of them. The company I used to work for is this one right here. And I know that because, well, it says Verimune, but all of our medications have the same box. They were really, I guess it's a good thing, they saved money, but Verimune is used, it stops the transmission from mom to unborn child. And so the company that I used to work for, they just ship caseloads of this to Africa just to stop the spread of AIDS from mother to unborn child. It's just given free of charge to anybody. So that has really helped a lot. So if you are HIV positive and you find yourself pregnant, there is a medication that stops that transmission. All of these other drugs, it used to be that a typical HIV patient would be on, say, 5 to 20 medications. Now it is down to 1 because of this amazing drug right here, Truvada. Okay, Truvada has shown to lower the presence of the virus in the blood so much that it is virtually undetectable. It also has been approved to be used as prophylactic or a preventable or preventative. So if you are in a relationship with someone who is HIV positive and you take it, it reduces the transmission. It reduces the likelihood that you will get it from that person. Okay, so this is an amazing drug right now.
That's amazing.
Yeah, no, it really is. Have you seen some of the commercials? Because there's another one on.
No, it's almost emotional for me to hear this, just because I guess because I'm probably about the same age as you, and I remember the AIDS epidemic, and I grew up in it, and it was so scary and so awful. And I actually have a friend who had AIDS and is still alive and has gotten a lot better. I didn't know all of the details. I just know that he is like he's actually thriving, he's doing well,
Mm-hmm.
but I saw him when he was really sick, and it's just such a terrible disease. And this is just phenomenal that these things exist. It makes me so happy.
Yeah, I agree with you. Yeah, AIDS was so scary. And we just, it was so scary. And and then even growing up, like being a teenager, I mean, it was just something that like just kind of loomed over you. It was so scary. And you know, I've
Totally.
I've never had the HIV test. Um, which I would assume because when I was younger, young 20s or whatever, probably, I don't know if they even had it or it wasn't something that was kind of just regular. And then, of course, when you're pregnant, you get tested. And I'm a regular blood donor, and I really don't feel like I'm at risk now. But, you know, I, I, I highly recommend to go get tested for anybody. They give you a little card. I feel like we should have that, like just with our ID, that we have like a little card that says I'm tested and I'm clean, and just go flash that at like the bars on the weekend, right? Like a
Yeah.
badge of like,
No.
I'm good, and you demand to see it from someone else before you, you know, um,
Yeah.
go hook up, right?
Yeah, that's a good idea. Yeah. No,
I don't know if
I
they'd
mean, I
ever,
don't have any need for it anymore. Like, I mean,
right,
like it's not like
right.
gonna happen to me, but I think it's a really good idea. I think it's really good to like break down the stigma that was there for a while with
Yeah.
HIV too, because
Yeah.
I remember I was I mean, for good reasons. You're so scared of it. It kills you. I mean, that
Yeah.
back then it was a death sentence.
Right. Right. Right.
Yeah, we were all so scared. But it's really important to just know that we can, I mean, with drugs like this that can reduce the transmission and stuff like
Yeah.
that, it looks to me like we could eradicate AIDS with these
Yeah.
things.
Yeah,
It's amazing.
I fully agree. I think it's amazing. And just so you know, you hear people, you hear some conspiracy theories where people say, that it was government made. There's really no evidence for that, and they really have traced it back to this, the primate version of HIV. And um, the other thing is, they say, well, why don't they come up with a vaccine for it? Well, this is such a tricky virus that it's always changing. And so as soon as you get anywhere somewhat far along in the research or the studies with an HIV vaccine, the virus has already changed. And so the vaccines are just not effective, because it's ever changing. So the fact that this is doing whatever it does, where it comes in, my gosh, where it comes in and it's, I don't know, whatever it's doing. Again, I don't know what
Yeah.
it does, but it blocks that from happening. And so this is just super cool. I guess kind of like the COVID vaccine, right? It's not trying to inject you with the virus, like, which is the flu, right? And this is why some years the vaccine for the flu is not very effective, because there's so many changes and there's so many different strains that some years the flu vaccine is ineffective. Well, the same thing would be with COVID, right? We've already seen it mutate. We've already seen the changes within just this 1 year. So the Pfizer and the Moderna one go in and affect it differently, right? Program your body to
Right.
fight it when it comes in, rather than try and give you some of the vaccine or the virus to change or block it at that point. But so
Right.
yeah, this is super cool. Really no longer, you guys are too young, but Rebecca, you and I know that it was also believed that if you got it, like you said, it was a death sentence unless you were really rich, right? Unless you were like Magic Johnson.
Right.
And that is no longer the case. You will get HIV medications. I promise you. You will get them. They're accessible. If you can't afford them, I believe they are just honestly given to you. Okay. So,
They are. my friend, my friend that I mentioned who has AIDS and is really open about it, and he's had it for a long time, and I became friends with him in the late 90s, and he was really sick then, and there wasn't, I mean, back then it was, I think, AZT, and he was sick for years. Like, I mean, it was like every other year it was like, oh, is Adrian gonna die, you know?
Yeah.
He got really skinny, he was in the hospital, and now you know, and I didn't know the details, you know, I don't ask people for that kind of stuff, but I know that he's just, I mean, doing great.
Yeah.
He's an older guy doing, you know, like he built a house, like, and is probably on this stuff, I would imagine, because he's
Yeah.
healthy. It's amazing.
Yeah. Yeah, it really is. It really is amazing. And just in case, if any of you are ever sexually assaulted, and raped, or if you were ever got an accidental needle stick, you can be given these medications prophylactically, and you probably will not get AIDS or HIV. And so that's really nice to know as well, right? So these medications are doing really well. I know this is not really Freddie Mercury. We're obsessed with the movie Queen, and so those are Rami Malek. But you know, Freddie Mercury, we know, is a very well-known HIV/AIDS famous person. Like I said, Magic Johnson, Charlie Sheen, you know, somewhat recently came out. And this pretty girl here is also HIV positive. So I put these pictures up of these, you know, good-looking people, so that you know, HIV, you know, we call it a beautiful disease because you can have it for many years and you will never know. And you can't tell, you know, they don't look any different than anybody else. So please, go get tested, just so you know your status. So these are those, you know, different types, pre-exposure. It's called PrEP, right? So this is somebody who would take it if they are, you know, going to be intimate with somebody who has HIV. This would be obviously if what I was talking about, say you were raped or you had an accidental needle stick or something, exposure. You know, obviously ways to reduce this, you know, the number one way, don't rub up in on anybody, don't have sex, don't, I mean, that's going to be your number one way. Just don't touch anybody from here on out, you know. But we know that that's not necessarily, you know, realistic, right? So, you know, be careful. You know, choose your partners wisely, and get to know them before. You know, avoid risky behaviors, things like one night stands and so on. Okay, use condoms. This is your number one way to prevent many of these infections. Okay, now this is important. Many people do not reveal that they have a disease with people they're having sex with. And in fact, one study found upwards of 40% of HIV positive patients did not tell their most recent sexual partner that they were HIV positive. And that 40% to me is the 40% that admits that. Not many people would admit that they did that. You'll have a really hard time trying to sue somebody for doing that to you. Those cases are not holding up in court. You would have to prove that this person maliciously went out and purposefully was trying to manipulate you into having sex so that you would get it. They view sex as a legal contract between two consenting adults. And when you enter into a legal contract, then you are assuming you know the risks. So they are saying you should know the risk when you enter into a sexual contract with somebody, and you should protect yourself from those risks. Okay, so just know that many people do not reveal. At when we had face-to-face classes and everything was full swing at EPCC, every year we would have the La Fe Clinic come out and they would do free HIV testing. I think it's important for you all to know that every year there were positives at EPCC. One thing that was really crazy that stands out to me was they were telling us about a couple that kept walking by. This was at the Valle Verde main big annex. And they were sitting there, and you know, when you're sitting there at a booth, you start to notice the people that walk by over and over and over again. And it was this one couple kept walking by, and she got the feeling that the girl wanted to get tested, but the guy was avoiding it or refusing. Well, eventually by the end of the afternoon, I guess she had convinced him. So they went and got tested. They both came back positive. The lady had to take them out and, of course, you know, talk to them and counsel them and get them the help that they need and the resources and things like that. During that conversation, it came out they were engaged to be married, and he knew he was positive, and he never told her. He was getting treated in Juarez, but still never told her of his status. And that's a couple that's getting married. So I can guarantee you, I would bet money on it, and trust me, I am not a betting person, that if you are just hooking up with someone, I can guarantee you they will probably not tell you. So you need to use condoms. You need to protect yourself, okay? Because no one else is going to do it for you. Anal intercourse is the #1 way, okay? But that's not to say that you can't get it vaginally. And that's not to say that you can't, you know, get it with, I don't know, other rubbing up on each other or whatever. There's got to be fluids and so on, okay? Let's see. Yes, you need to tell them, let's see, go get tested. These are things that look scary, but these are not STIs. Here's a canker sore, right? This guy probably, or girl, probably bit their lip, and eventually it turned into a canker sore. This is like folliculitis, just little infection of the follicles. I don't know what, I think they say they're just little, bumps on the glands. I don't know what these are, something with the oil glands or something like that. And this is a cyst. Okay. But again, if you don't know, go to the doctor, right? I promise you, you're not showing them anything that they haven't already seen. And it's best to know, right? It's best to know. And that's it. That's all I got. You guys got any questions? I know I've gone over. No, we're